Good morning and welcome to Breaking Barriers Symposium 2020, Day 4. It's Thursday, November 19th, and we're thrilled to have you all with us to have a morning-long exploration of the fourth pillar in integrated services modeling for children and youth in California. Today's theme is how the blending of dollars and fiscal resources supports the integrated care approach that is so needed and is being pursued in so many different ways in California. Thrilled to have you with us. My name is Richard Connect. I'll be your host off and on today, joined by Steve Hornberger at times. And we're thrilled and need to acknowledge the support for all four of our weekly sessions this year from the University of California, San Francisco Dyslexia Center, the Mental Health Services Oversight and Accountability Commission, the California Children's Trust, San Diego State University Social Policy Institute, the Integrated Human Services Group, and the law firm of Atkinson, Adelson, Loya, Rudd, and Romo. Without their generous support, Breaking Barriers would not be possible. So we appreciate each and every one of those organizations and the people who are connected to Breaking Barriers. We're also supportive, appreciate the support of Learning Ally, our technical assistance today, helping us get to you logistically through a remote setting. With all that, thrilled to have our first introductory remarks this morning from Toby Ewing, whom many of you know. Toby's the Mental Health Services Oversight Accountability Commissioner, and look forward to some remarks from Toby to get us started today. Good morning.
Good morning, Richard, and thank you, everybody. We appreciate the opportunity to be here. On behalf of the Commission, I want to welcome everybody to Day 4 of the Breaking Barriers 2020 session. We really do think this is important work. It's part of the reason why we're a co-sponsor of the event this year. And we also just want to recognize how effectively you've pivoted given the realities of COVID-19. This is your final day, as Richard said, focused on finance. And it's a year that we'll remember because of the challenges that we faced. And it's also a year that we can remember because of how we have risen to the opportunity that those challenges have created for us. For those of you who know about the Mental Health Services Act and the Commission, you know that we are a product of this voter-passed initiative from 2004, and that the Mental Health Services Act generates significant revenue to support the services that we provide to Californians through our mental health care delivery system. I'm going to talk a little bit about the Mental Health Services Act, and not the funding, but the policy, because the policy in that act, I hope, can shape the conversations that you're having today and the approach that you bring to this work. The Mental Health Services Act is broadly drafted. It focuses on prevention, recovery, innovation, and transformational change. And I think those are many of the values that really drive the conversations within Breaking Barriers and the work that many of you do. The Mental Health Services Act is much broader than mental health. It focuses on housing, education, employment, safety, health, security, and family connectedness. These values that touch upon our child welfare system, our schools, housing programs, workforce programs, and justice systems. The very silos that we're talking about over the course of these 4 days of Breaking Barriers. The Mental Health Services Act also, importantly, says that we really need to look at the services that we're providing through the lens of the people we serve. And I think there's a session today on that idea. As you focus on finance, I really want to challenge you to think about disrupting our traditions. Not all of the traditions that we have in place today are working. Not all of them are effective. Not all of them are the best that we can do in how we deliver care, services, and outcomes for the people that we serve. Both the taxpayers who generate the dollars that are used to support public programs and the families, the communities, the individuals who need these services. We need to ask ourselves and each other constantly, how are we doing in terms of meeting goals? Yesterday, I had the opportunity to speak with a group of social work students. These were relatively new students in terms of the profession, and I asked them, from their perspective, how are we doing in delivering mental health services? Many of them raised their hand and said, we're doing phenomenally well. And I was taken back a little bit. But what they meant by that was that they had been able to access services that they found to be very productive and very helpful. But when we stepped back and began to think more about a public health model, to think about the population level outcomes that we're achieving. They rated the outcomes between 0 and 4 on a scale of 1 to 10. We really do need to rethink our goals and our strategies and look through the lens of our own families. How are we doing in delivering care to other people relative to what we would want, the dreams that we have, the outcomes that we hope for and desire for our own children, our parents, and the families and the people who are around us? We need to rethink these service systems through the lens, I would argue, on behalf of the Mental Health Services Oversight and Accountability Commission, through the language of the MHSA: prevention, early intervention, population health, comprehensive care, care that is driven by the needs of individuals and families, where we can tailor responses to the unique needs of the people we're serving. Doing all that in a way that integrates all of the tools that we have, including funding. We need to do that in a way that is designed by and for the people we serve, who rarely have a seat at the table of decision making. That needs to change. We need to start with very clear goals and empower youth and families to set those goals and shape how we respond to them. The Commission last month adopted a report on school mental health. If you haven't seen it, it's on our website. And it calls upon, one of the key recommendations is to empower the voice of youth in the work that we do. The Commission has been working with a youth leadership group. We've been traveling around the state in person when we could, and virtually now under COVID, to talk to young people. They have incredible ideas about how we can better design service delivery systems to meet their needs. And they're not all expensive. Many of them are low cost, potentially highly effective strategies. We need to really ask the people that we serve constantly, how are we doing? How can we help? What is working and what is not? And through that, we can better design the systems that we have in place to serve those folks. In California, we are seeing significant changes in our mental health systems. We're developing phenomenal partnerships with our county leaders in terms of our early psychosis work, in terms of partnering to build out school mental health strategies, in adopting an international model for youth drop-in. We now need to connect the dots between those systems so that we're serving folks in ways that are more integrated and seamless. COVID has brought forth these very difficult challenges in terms of mistrust, fear, and misinformation, but it's also allowed our better selves to show through. We're seeing tremendous shifts because of the urgency of COVID. Now we need to bring that same urgency to the work that you're doing today in terms of our human service delivery system. I would challenge you to set aside our tendency to say that this is difficult, to say that it can't be done, that it's too complex or too expensive. Instead, set back, set a stretch goal that all children who need care shall receive the care they need in a culturally appropriate manner. And then we need to say, what's it going to take? And how can we draw upon the vast resources of this state, all of our partners, to make it happen? I'm asking you to have the will to be disruptive. Don't settle, be willing to innovate, and let's try something. We can improve. We'd much rather live in a state that's trying to get better than a state that has given up. Thank you very much for the chance to come and open up today's session. We really appreciate the work you're doing. I want to thank Elizabeth Estes and her team for making this happen, and we hope you have a wonderful day.
Toby, thanks very much. If participants will click on the next session, we'll be in there in just a moment. Thanks again, Toby.